there's so many remedies out there. Whenever I eat a fruit, I always, I don't know if it's a bad habit. Every time I have a fruit, I go, oh, what's the benefits of this fruit? And you got a list of stuff from preventing cancer, from good for your blood system, for all this and all that. But in the back of my head, I know that that's a suggested benefit. It's not a guaranteed benefit. Do you think we do enough research into the benefits of healthier eating or healthier herbs?
Oh yes, there's so much information out there. There's so much, and talking about research into it. In terms of what we do, the guidelines even about how to manage a lot of conditions that might develop, especially as you're getting older, for example, maybe high blood pressure, etc. The first thing they always say is to start with a healthy lifestyle.
Sure. Affinity Xtra. Be extra.
Yo, people, this is your boy here, Roger Moore here from Affinity Xtra, celebrating gospel music, black origin, and you here on a special series with my Edge show and the NHS. Real excited about this. I am so proud to see so many black professionals in the form of medicine. I am so totally inspired by this, on just that respect. And I want when young people see this, they see that I can be a doctor, I can be a head pharmacist, I can be a scientist, and be successful and be respected, and there's pathways for that because people have led the way 100%. So that's really powerful for me as we do this special series with the NHS in the Black History Month. And as you know, guys, this is the Edge show and we're here to learn, and I'm just here to be a conduit and an information a guide, to kind of like communicate with NHS professionals, and as a black community really engage with this support for us that we're not engaging with, and we're dying because we're not engaging with this. I know we've got trauma in the past. I have trauma from the past. I have trauma of today, but the reality show is that we need to maximize these services, and we have people that look like us, who are us, who's open to support us on this journey. And I'm with the lovely Patricia Ojo, and she's here to explain to us the art that I didn't think was an art form in the NHS system, which is being a pharmacist, and she owns her own practice. But just introduce yourself and just give us an idea, of your expertise and how does it look? Are you that person behind the counter that no one talks to, and they give it to you at the back and you go, I've got 5 of them, but you got to wait later? Are you that person?
I'm Patricia Ojo, as you said, and I'm the owner and resident pharmacist actually at Stephen's Pharmacy in Footscray Road. As you probably all know, we pharmacists, community pharmacists, are contracted by the NHS to offer pharmaceutical services. Okay, and with regards to your question that you asked, am I that person at the back who is there and then basically something gets handed over across the shop floor? No. I'm the pharmacist who's there and the patients see me. I thrive best when I'm actually on the shop floor and I'm talking to my patients. So if a patient wants to see me in the pharmacy, they will see me. We are accessible all the time. Okay. I check the prescriptions. I have a whole team of staff who are trained actually to also be able to offer advice. But as a pharmacist, a lot of things can get referred to me. Yeah. So I am ever present when I'm in the pharmacy, and that's what community pharmacists are.
Wow. You kind of came with a language like you almost, which I never realized pharmacists have is almost we're your patient, and you almost like that last line of defense when it comes to the prescriptions, and you look at things, you're almost verifying what the doctor's kind of giving people as well. So that's definitely cool. So yeah, we got winter coming now. What can we do, to help ourselves? Because I feel like when it comes to colds now, it's like it's COVID or nothing, and it's like, oh, it's just extreme. Just you just got to get through it.
So that's exactly where your community pharmacist comes in. Okay, so you can come into a pharmacy and of course, you have access to a pharmacist, but you also have access to other healthcare professionals. We give advice on managing any conditions. And sometimes people will come into the pharmacy because they don't know whether or not the condition they have is serious or not. We give advice on a lot of minor illnesses. We can advise you on what medication you need to take, how that medication might be taken alongside other medicines you're taking. And also we can advise you on when you actually need to see somebody else. And this is where it's really important for people to think about their pharmacy first. Some people are able to self-care and they can actually walk in and say, you know what, I've got a sore throat. Can I have that lozenge? And they're quite happy that the symptoms they have are minor enough that they will go away on their own and they just want something to soothe it. And that's where we come in as pharmacists. We have the supplies there for you, but also we can advise you on what more you can do to stay well and stay better. So talking about winter, we know that some conditions get a lot worse. They can get a lot worse during the winter, especially people who are over 65. They might suffer a little bit more from winter ailments or might feel a little worse when they catch illnesses over the winter. But also some people who have long-term conditions. So we're talking about things like diabetes, or we're also talking about people who might have asthma or what we call COPD, some lung conditions, or any long-term conditions that makes your immune system a little bit lower.
Wow.
And that's where your community pharmacy will come in. And there's a community pharmacy nearly everybody lives within 20 minutes walk of a community pharmacy.
It's true.
Okay.
It's true.
And for those areas that are a bit more deprived, okay, and if you talk about our communities maybe being a bit more in those sort of localities, you've got even more pharmacists. So 95% of people who live in deprived areas actually have access to a community pharmacy within 20 minutes walk. And that's really community pharmacies actually help to address the health inequalities that we have within the NHS. So that's part of what community pharmacies do to try and make sure that we give access to healthcare.
It's interesting what you said, because obviously what you said there, I really and truly, I feel like I'm inconveniencing the pharmacists. And you are literally saying, you know, pharmacists are there to listen and to talk to people and to show them what product to suit based upon their symptoms, what's best out there. Well, I feel like if I get it, I'm almost like, am I going to inconvenience the pharmacist by asking the question?
That is part of what we do. Part of our NHS contracts is to offer self-care advice. So that's what they call essential service. So there are certain services that to have a community pharmacy contract with the NHS, you must offer. And self-care is one of those. The idea being that rather than going to knock on the wrong door to seek help, you knock on the right door. Community pharmacies are open. It's a walk-in service. Most people will not have to wait very long. You're talking minutes rather than weeks or days to speak to a pharmacist. So that's part of why the NHS has got community pharmacies, contracts, is to actually give access so that patients who've got much more major illnesses, serious conditions, are going to the GP, and those who've got minor illnesses come to the community pharmacy. And community pharmacists have trained for 5 years, with the use of medicines, understanding of medicines, and how for you to use those medicines. And they're also trained to know how to send you off to the right person and the right healthcare professional. So they will tell you whether or not what you're talking about you can treat yourself, when you need to actually seek further medical advice, when you need to go to your GP, or they can also give you advice on seeing other healthcare professionals or other professionals who are within that health system, if that makes sense. So community pharmacies are basically almost what we describe as the front door of the NHS.
No, and you're kind of breaking norms and mentality here. So is this something new to pharmacists, or it's always been set up like this and just people just never knew? Or is this a new thing since COVID? There's been a rejig of the NHS and now you guys are frontliners. Was this nothing new?
No, it's nothing new at all.
Wow.
Community pharmacies have always, since 2005 actually, so I'm going back a long time now, when we had that new community pharmacy contract where we had to offer the self-care and all these essential services. They've now added on other services that are a bit more advanced, and you have to sort of sign up to those. But in terms of the fundamental service that we offer to the NHS, being able to go and see your pharmacist and ask them about your health, how to look after yourself. Most community pharmacies are also registered as healthy living pharmacies.
Okay.
So that might come as a surprise to you. So part of what we do is to help to promote healthy lifestyles.
Yeah.
Healthy weight, exercising, stopping smoking, sort of all of those things that would help to maintain your good well-being so that you don't fall ill is all part of what we do. And I think what has happened a little bit more over COVID is that where people couldn't access other services, a lot of people became a lot more aware of actually the expertise that was within the community pharmacies. And a lot of people still think the doctor or the GP surgery when they have certain conditions. But one of the things we know is that not every condition needs medical attention. Some conditions are what we call minor. They will get better on their own with or without treatments. In fact, they will get better on their own. But what you can do in the community pharmacy is when you come in, you can get something that might reassure you, give you an advice to say, actually, this is something that will go away on its own. And if it doesn't go away within a certain length of time, this is what you do next. Or the community pharmacist can give you something to help relieve your symptoms. So that sore throat can get a little bit less sore because you're using that local anesthetic lozenge, or you're taking that painkiller, which is appropriate for you to take with certain medicines you're already taking. So this has always been there. But also, if you think about it, the NHS has really got resources that it needs to try and make sure that everybody is accessing the right place. So they're pushing open the right door. And what community pharmacists do is really to give the community, we are in the heart of the community. There's nobody who cannot access a community pharmacy if they want one, and they don't need an appointment to do that. So when they come into the community pharmacy, they have access to a very well-trained pharmacist, but they also have access to trained medicine counter assistants. You can't work within the pharmacy without the training. They've got dispensers, and we've got a whole team of staff who are trained to be able to help to promote sort of healthy lifestyles and self-care, but also know when to ask you to speak to your pharmacist as well. And the pharmacist is also trained to know when to actually say, no, this is an urgent one. You go and seek urgent medical attention. Or actually, this is one that needs to be seen by the doctor. So within the community pharmacy is where we actually give you that access of care within the NHS. And, the main thing we want to do is actually support you to be able to live a healthy life, but also to help you to get better quickly when you're unwell, if that makes sense.
No, 100%. Now, we want to be boosting up our immunity now, coming up to so on now. So do you see, we're coming up to the winter. We don't want paracetamols and so on. We want some natural products and stuff. Or do you are introducing natural home remedies to help boost immunities, or is it a case of just take this tablet and we've made and
most community pharmacies, you're talking about boosting your immune system. A lot of community pharmacies, the majority of them will have vitamins and supplements. The beauty of coming to the community pharmacy is that if you have any medication you're taking, and we know that certain medicines can interfere with other medicines, they can actually advise you on what vitamins and supplements you can take safely with your current medication that has been prescribed for you as well. And for those people who want to actually prevent the ill health so that they don't actually need to take medicine,
that's good.
That is exactly what the community pharmacy is able to do. We will advise you on how to get well or stay fit, to adopt healthier lifestyle so you don't develop those long-term conditions that could then lead you to then take certain medicines. But also we're there to be able to actually listen to you so that if you've got certain questions about medication necessarily that's been prescribed for you. So for example, there's something called the NHS New Medicine Service, and we know that about 30 to 50% of people who have got a long-term condition do not take their medication that they've been prescribed correctly. What the community pharmacist is able to do within this service is to actually follow you up within those first few weeks of starting the medication. The idea being that we can tell you what to expect from the medication. So for example, side effects, if there are any. We can tell you how to take the medication. We also give you advice on how to help you fit any medication that you are taking within your lifestyle so you get the best out of that treatment that's been provided for you. So you can get the best treatment, but if you're not taking it correctly, you might not get the best help. And this is not just within the UK. This is sort of what is an international thing that we know that most people, when they start new medicines, are not able to take it properly because of certain lacking things. So the NHS is invested in that type of service, and the community pharmacy does that. Also, the community pharmacy can then go back to the doctor or the prescriber who initially started you on the medication to let them know, with your consent, of course, that that particular medication is not suiting you or you're having issues with that. We're there to support you. We're not there to necessarily just always give you medication. We certainly, what we do is about being what we call patient-centered. So is what you want, we will help you to get the most out of what you've come in for. And for some people, it's about talking to them about lifestyle changes or adapting things so that they're able to stay healthy, so that they're taking control of their health and therefore don't need or don't develop some of these complications that can happen.
Great. Well, I'm like this. Whoa, is this always? I need to really get on this now, because that is the valid point. Because when I go to if there's no expert in there, and myself, I used to not now, but majority of my life I've been on because my epilepsy, I've been on Epilim or sodium valproate, and I'm always conscious about okay, I gotta be careful, because if I take something, it could be there's no it's just nice to know when you go into pharmacies, you could just say, this is what I take, what adverse reaction is. And I must admit, when you go into health places, it's great, but there's no list of, or you definitely can't go to the person at the till and go, oh, if I've got this and got that. So you ultimately, it's the expertise which the pharmacist does do, which is absolutely fantastic. Do you feel that we do enough to research natural remedies? Do you think we do a lot of it, or we don't invest enough into it? Because you've seen the WhatsApp messages. There's so many remedies out there. Whenever I eat a fruit, I always, I don't know if it's a bad habit, every time I have a fruit, I go, oh, what's the benefits of this fruit? And you got a list of stuff from preventing cancer, from good for your blood system, for all this and all that. But in the back of my head, I know that that's a suggested benefit. It's not a guaranteed benefit. Do you think we do enough research into the benefits of healthier eating or healthier herbs? Oh yes,
there's so much information out there. There's so much, and talking about research into it. In terms of what we do, the guidelines even about how to manage a lot of conditions that might develop, especially as you're getting older, for example, maybe high blood pressure, etc. The first thing they always say is to start with a healthy lifestyle. So we're talking about stopping smoking if you're a smoker, drink with alcohol within the recommended limits, so no more than 14 units a week. If you don't exercise enough, we say increase your exercise level, moderate intensity, 2.5 hours a week. If you're going to do a really high intensity exercise, then 1.5 hours is enough a week. And if you don't eat healthily, we say try and make sure that you have your 5 a day of fruits and vegetables, more so vegetables if you've got problems with regards to regulating your blood sugar. So there are a lot of things that always, even if you've got a high cholesterol, for example, we talk about having more fish, one portion at least of oily fish in your diet a week, having more vegetables, exercising a bit more, all of these things. There is definite sort of evidence that these things improve your health already. The medicines come in later. Of course, there's some conditions that you would need medication for, but don't forget, this is where with our communities it's really important to understand when you're being prescribed a medication, there is always that thing. There are certain conditions that by improving your lifestyle, you can actually find that your prescribers can de-prescribe. They can take away certain things. Yeah. But the real important thing is about health prevention and promoting really healthy lifestyles. And that's where the community pharmacist comes in. And all pharmacies are registered healthy living pharmacies now in the UK. So if you go into a pharmacy, you've got at least one person, including your pharmacist as well, who are trained to be able to give you healthy lifestyle advice. In fact, most staff are trained to do that. Wow. So they will be able to tell you where else to go, other things within your communities that you can be signposted to, who can help you. You know, you name it, they've got them. It's all within the system. You just need to access it. And that's where we can help you to navigate the right places. So it's not always about going to the doctor. Yeah. Sometimes it's about going to the other right person who can help you to get that best help.
Oh, no, 100%. You know, I'm 100% into, and I encourage people to take care of their bodies, man. You know what I mean? I always say to people, you know, I think within a faith culture, I think we are very arrogant when it comes to our body, because we serve this amazing Savior who seems to produce miracles. Every time we pray to him, he will heal us and whatever. So we get lazy with the body and we don't realize that he's given us his amazing body. But so we got to look after it. Really, we're not just going to destroy it. And I feel that there's that culture, a subconscious culture to know that God's got it. God's going to heal me. I've got this and whatever. He'll get me through. I can just not look after my body well. You know what I mean? I think that's a culture which we've got to break and come against. I think people are improving their health naturally, but my concern is like he says, is accessing the services. I didn't see you guys on the radar. There's certain things like, even when I got a bit of a stomach upset, I can just pop into my local pharmacist and have a quick word with them. Do you feel sometimes the pharmacists get a bit of bad press? They almost feel like, especially when you have to pay them £9, and we feel like.
To be honest, for those people who have to pay for the prescription, it's the prescription charge is means tested. So you know, not if the pharmacy, again, this is where your community pharmacists and the staff can help you. They will tell you if you are actually able to apply for certain help with your health costs. Okay. So be it a prescription charge, yes. There are people who are entitled, and sometimes people come in and they pay a lot of money for their prescriptions, but the staff are trained to say, actually, you're paying this amount of money. You might be able to actually get this sort of help with your prescription charge, or you may well be able to get what we call a prepayment certificate, where you're not paying so much money every time, but you've paid in advance. So there are things that can be done. And certainly your community pharmacists and the team are well trained to be able to find those people and help them or have those conversations. In my experience, it's not been an issue, but sometimes we know that people might not take medication because they find it expensive, and that's where we come in. We will always have very, sort of open conversations, and this is where being in the community pharmacy helps, because we've got the ability to have those conversations that they may not have the time to do so when they've booked certain types of appointments. And that's where we find out things about people. We know our communities. We're in the heart of the communities. Most community pharmacists, especially independents or even the large ones who've been there for a long time, they've seen children born, they've seen them older, and then they have children. So they know families.
Yeah, they know the families.
So they know the circumstances. They normally tend to live within their communities as well. So have an understanding of the communities they're working in, at least, and therefore they know what they can do to support them.
Cool. That's great. No, that's fun. That's fun. I'm feeling good about my pharmacist now. You know what I mean? I'm going in there. Cool. So effectively, you guys are like partners with the GP or something like that. Still, yeah. You guys work in tandem. I know now, like, over the past, say, about 10 years ago, this thing came in when they said, do you want to pick it up from your pharmacist? I was like, hold on a second, how are you writing this prescription and it's already going to be at the pharmacist in 1 hour? I remember before having to walk over to your pharmacist and doing all this, but the connection, do you think that connection with the GPs has been really an advantageous element of to and fro? Because that came in about 10, 15 years ago when I'm starting, it started moving, to and fro. And has that really helped the NHS family from a general practitioner's viewpoint?
It has. The community pharmacies are parts, we're literally, sort of part of the NHS system.
Yeah.
We work very closely together, and it's very collaborative because a lot of the things that we do in the primary care actually mirror each other. So we have an open communication with that. So we can go to the GP the same way that they can come to us, and we have mutual patients. So most community pharmacies will have local GPs around them, and we all have the same conversations. We all understand what our community needs.
Yeah.
And the way we work is to actually make sure that we are all doing what we need to do to make sure that the health of that community is taken care of.
Yeah.
So part of the system certainly is there. And actually, when you do see your GP, you can nominate a pharmacy and say, I want my prescription to go here or there. And they get to understand that. And there is that continuity. But patients can choose to go to any pharmacy. And that's the beauty of what you were alluding to as the electronic prescription, is that if you were in one part of the country and you were stuck, you could actually get it sent over to that part of the country for you. So we work collaboratively, and that's one of those things that has made the system a lot easier to navigate. Yes.
No, that's absolutely fantastic, and like I'm making sure that I hit all the points here, guys. That's why I'm looking across here and I'm going, oh my gosh, we're kicking out these points like crazy. We even hitting points before they even get there. I was thinking, hold a second, we dealing with that right now. And what's amazing is ultimately when we're collecting prescriptions and so on, we are going like this. We're walking in now, you're collecting prescriptions, and imagine if they know you, and they're going, which doctor gave you this? And one encouragement what I did get off from Patricia is the fact that basically sometimes we don't get the medication because we're scared of the cost. Yeah, please, as this is important now for our community. I'm not saying everyone's book pocket who's listening into this show, but the reality show is there's support out there for you. And too often we're too afraid to go to the doctors. We're too afraid to go to the pharmacists because we can't afford the medication. You know what I mean? That could be a franker conversation that you could have with the pharmacist. Correct me if I'm wrong, Patricia.
You're quite right. I mean, there are some medicines that you actually don't pay for because of what they are and because of the condition that you're treating. So I think it's really important for people to realize that the way that the community pharmacist has been set up is for you to feel open to go in there. Most community pharmacists, and in fact, there's no community pharmacist who would have you come in and ask a question about your health or your medication, and they would not make that time for you. Even if you have to wait a few minutes to speak with them, they will make that time for you because that's part of what we do. That's the whole essence of where we are. Cool. Yes, we are doing other things, but there's so many other things that you get from your community pharmacy. So if you haven't visited your community pharmacy to learn about how to maintain a good health, talking about the winter months especially, the fact that some conditions are going to be a little bit worse over the winter months.
Yeah.
A lot of conditions are a little bit more frequent. Your colds and flu, the sore throats, even people who've got arthritis, the pain might be a little bit more. People who have dry skin conditions might end up having even drier skin because of the cold air. All of those things, even migraines. For some people, the temperature can trigger off their migraines.
Wow.
These are all conditions that actually can be managed, and your pharmacist can support you to actually maintain better health over the winter.
That's crazy. No, that's a fantastic. Just one cheeky one before we go, yeah? One cheeky one, I have to check it. What is it? Is there something, when you do with black people when they're coming to the pharmacies, yeah? Is there something that unique to what we ask or how we ask? Is there something where you just have to giggle to yourself? We always ask this certain question, or do you find us very skeptical, or is it any or are you just thinking everyone is no like, oh Lord, they asked that question. Or are we that person who asks too many questions, or we make sure this and that, whatever? Is there anything unique about how we approach the pharmacist that you find? That's a cheeky question.
Nothing is too little. Nothing is too complex. Any question, if it's a question that you feel you need to ask, it's important.
Good.
And I think that's really, really important to never, ever go into the pharmacy and wonder whether or not this question, I'm asking too many questions. In fact, most community pharmacists that I have dealings with day to day that I've come, in fact, I have yet to come across a community pharmacist who has had a patient come to them and ask them a question and they've not. That's what we do.
Yeah.
If you've got a question, we've got some answer. And if we don't have the direct answer for you, we know how to find it. That's part of our training.
Brilliant. No,
so
that's really breaking down a mindset that we need to have. People like, don't think we're coming with too many questions, and utilize these guys. It's not about getting your money's worth. It's not about that, people. But it's about utilizing these guys. Please walk down, like you said. My pharmacist is literally 5-minute walk. You know what I mean? And then I have to walk back up a hill afterwards. But anyway, I got a 5-minute walk from my house. I could jog it there in 1 minute. So I've got no excuse. Other than I can go another 10 minutes to the next pharmacist. And then the nearest other pharmacist is another 15 minutes. So there's literally every 5 minutes is a pharmacist from my house, So we got no excuses, guys, and I appreciate our guest today for explaining to us. They're there for us, man. You know what I mean? And I know this is the Black History special. But why are you going into this information and details for? Listen, it's not all about these guys. We don't want for them to see yourself as the guys who are there trying to force the vaccinations on us, like the flu and the COVID. As much as that's part of you, maybe we're not touching that today. We're talking about, questions that you have about all aspects of your health. Yeah. And it starts from good, healthy living. And I think it's an extremely good point for us to push. Part of this one is preventative. Prevention, guys, is better than cure. I believe that in the spiritual as well as the physical. You know what I'm saying? And we need to step up in that. What else? What would you say? Just another last point we want to say to the community out there, listening to even religious organizations, the churches and so on. How can... I know it sounds weird. Apart from building a pharmacy in the back of church, how do you want them to? Do you want them to really get this type of podcast out between the people? How do you want to really encourage them in terms of engaging with the local pharmacists and support? Because everyone's calling Pastor, I'm not feeling too well. All right, then we pray for them. And we don't think of sending them to anybody. God's gonna deliver you tomorrow. Amen. Yeah. And then walk away, and the person's getting more sick. You know what I mean? And next thing you know, the person dead or extremely sick in hospital. And if he had said, "Listen, we pray for you," speak to your local pharmacist. I mean, what would you say out to faith groups out there?
Yeah, community pharmacies are part of the communities that they live in. Okay. We are there to be able to work collaboratively, and it's not only with other healthcare professionals, it's with other charities, other organizations, talking about faith groups. And a lot of work, even during COVID, has actually been done, and people have come together as communities to really, because what we do is to reach people where they understand. So being a partner in your environment, in your decision, as opposed to coming to tell you. So I certainly will encourage faith groups or people who've invite your local community pharmacist to come and tell you about what they do, or go in and just introduce yourself and say, I'm around the corner here, I haven't really been in before, and, I just wanted to talk to you. And you'd be surprised how many would be able to have a conversation with you. And these things can happen through conversation. If you approach or they approach you, be open to see what they do. Because I certainly, recently went on a park fest. It was a dog show. But one of the most important things was the fact that in my community, I wanted to raise awareness about hypertension and high blood pressure and how we can do at a certain age that becomes more of a possibility. And that's something that the NHS wanted, sort of us to, as pharmacists, to do. So I decided to go out on an outreach as opposed to wait for them to come into my pharmacy, because not everybody goes into a pharmacy.
That's correct.
And there we did some blood pressure checks and had conversations with people, and they never knew actually that the community pharmacies can do that. And there are a lot of community pharmacies who do certain things. So I would say be open to have the conversations about health. That's what we're about. We're not only about medicine, we're about really promoting good health, because the best outcome for most people is that they prevent the ill health in the first place. And you've got a community pharmacy around the corner from you. Most communities have that, and the community pharmacists are very well trained to be able to have a conversation with you, which is not only surrounding about medicines, but really how to take care of yourself. So that you can maintain good health, or if you're just not well, to help you get better. And that's what we do quite well, because we're open. We're open nearly very long hours, more so than a lot of other systems.
Yeah.
We're open. There are some community pharmacies that are open 100 hours a week, a lot of hours. And most community pharmacies will open, sort of late as well. So you have the access out of hours, but you also have access every day of the week. And most pharmacies, in fact, there are pharmacies open 365 days a year. Your communities, the people who commission it, make sure that there is always a pharmacy accessible for anybody when they need it.
Absolutely. Thanks for this conversation. Really proud of the work that you're doing, and how much you bring to the table, and definitely for people who are listening in, please guys, utilize your pharmacists. This is all part of me personally being embarking in this series. I didn't even think they'll be touching you. I'll be speaking to pharmacists as part of the series, and so I'm learning as I go along that this is teamwork here by the NHS, and we really do appreciate the NHS for sometimes the works that was out there, and we as a people, we need to access this, because I'm seeing too many of my people get sick. We get sick, we're going to get sick, but sometimes we can prevent, or we can diagnose a lot earlier. You know what I'm saying? Because we got low success rates because diagnosis is taking long, because we're too scared to go to the doctor to get the results, and so many stories. Well, Patricia, thank you.
And don't forget, your pharmacist can tell you if there's something to worry about or something not to worry about. That's what we are there for. So, and it's often in a not, so in an environment that is a little bit more open and relaxed. So don't forget that can always be accessible to you, and that's exactly what we're there for. To help people work out what they need to do about their health.
Wow, this is crazy. Thanks again for your time. Listen, guys, I'm gonna close this one off, and I'm gonna go away, and I'm gonna be absolutely triage. I'm gonna be like NHS triage expert by the time I finish all these conversations with people. I'll be like this, going right. I'm telling you, I'm gonna send you over to this one. Just call Roger, and Roger will send you to the right services because I'm learning so much, absolutely so much. And we are gonna have these all in a playlist on our YouTube channel on Affinity Xtra, and literally all to do with health with the NHS. And now, if you got any comments, don't be rude, be real. Even if it's tough questions you have for the pharmacists out there, I'm sure I can get Patricia back on again, and we can address any comments or any issues you have, because the truth is the truth, guys, and we want to get to the bottom of everything, and every professional so far that I've spoken to is happy to come back on and deal with any questions that you have. This is not a runaway sell job and they go away. They're happy to come back on and have that conversation. So, Patricia, thanks again as we close off this podcast for your time.
Thank you for having me.
Yeah, man. You must be working these long hours in a day when we're going to do a recording. So we appreciate you taking the time, and it really shows, even after you guys' long shifts, that you have the time and effort to sow into spreading the news and the word within our communities about how the pharmacists, we can make use of our local pharmacists, so appreciate your passion and your love towards your community. Here on Affinity Xtra, this is your boy Roger here alongside the lovely Patricia Ojo.
Thank you.
Hey, this is your Bishop. This is your Bishop from Rock Solid. Thank you so much for watching us on YouTube. Thank you so much for clicking and subscribing and also sending these videos to other people as well. We are so hungry to get your support. So remember, check us out on our website, and also check us out on Insta and wherever you want to find us. On Spotify, you can play us all day as well. And just make sure that you are supporting this channel, that we are developing our agenda towards music of Black origin, and that is gospel music with a message. So please walk with us on this journey. Bye now.